When you think about it, you probably are already thinking about maybe eating healthier, wearing sunscreen, quitting smoking, or trying to. But do you think about exercise a great deal? We all know it's good for us. But there's a new campaign now by CancerCare Manitoba that's highlighting the link between movement and cancer risk. To talk more about it, Kyra Gawalko is here with us, Education and Prevention Lead with CancerCare Manitoba. Thanks for coming in.
Thanks for having me.
I should mention, if you're watching Kyra and I on YouTube, you're about to see some of those ads come up as well. So we're going to show you and talk about them as they pop up visually here. So these ads are on social media. They're on billboards. Can you describe sort of what a few of them say? I talked about the message behind them, but what do they look like?
Yeah, so the idea we kind of wanted to take was on, cancer loves, cancer hates. So, of course, cancer's going to love things that keep us sedentary, not moving a lot. And cancer's going to hate things that keep us active, keeps our body moving, our heart rate up, our breathing rate up.
So some of the examples, I think Ezekiel, let's put some of these up here. This is our YouTube producer here. So cancer hates counting steps, just with the feet in there. Cancer loves doom scrolling. I'm just going to read through them. Let's roll through them here. Cancer loves sitting still, and there's a picture of a big chair that, by the way, before doom scrolling, it had a person with a sheet in front, phone in front of their face. Cancer hates sweating, and there's an image of someone sweating. Cancer loves binge streaming. I'm feeling shamed and guilty right now. There's the remote there. That's a good thing, probably. Cancer hates bodies in motion, including your favorite moves, and it's showing someone dancing. And the one with steps has the feet in the picture there. Why did you take this direction? Why do you think it's going to land with people?
So when we first started thinking we needed to do something that was going to help, capture Manitoba's intention, we worked with a third-party company, came up with some ideas, couple concepts, and we did focus test it because we did want to make sure that whatever we did was going to resonate. And this ended up being the clear winner.
Can you share a little bit about why? Like, what did you hear in when you were focus testing about why it was landing with people? Is it a little bit of what I just said? I felt slightly shamed, but also it made me notice. Because I like to watch television?
Yes, right? It really did make you stop to think. And so the idea was, when we are doom scrolling, that, if you did see this ad, you might actually go, oh, I should maybe take a break, get up, move around.
Yeah. What's the actual goal with these ads in terms of people understanding the link? What's the link between how important movement is to prevent cancer?
Yeah, so there was a study a few years ago called Compare, and they showed that up to 40% of cancers can be prevented through a variety of different lifestyle factors. And of course, quitting smoking, number one. But second is physical inactivity. So we know that there is a large link between being physically active and reducing our risk of cancer.
Was that the same study where alcohol came up and everybody went, kind of also had a moment thinking it was, it's not just smoking, so to speak, right? That also is something that can affect rates of cancer.
Yes, alcohol is also on there, as with all of the other, modifiable risk factors, things that we can do to reduce our risk, as we've mentioned, sun and healthy eating.
Are there specific types of cancer that moving can prevent? Other than others, like which cancers does it particularly help with?
Yeah, so there's a variety of different cancers that actually can be affected, including, breast, colon, lung.
What about the method of promoting health and cancer prevention and digital advertising when you think about that? Because I mentioned this is going to be, held in different spaces. Tell me a little bit about whether or not that advertising works or what you understand about it.
Yeah, so we, again, wanted to, utilize the platforms that are supporting people in being sedentary. And so using digital platforms where people probably are more likely to be sitting or be sedentary was a thought that would be more motivational to be able to catch them in the act.
Target people where they're at, right?
Mm-hmm.
Is there an amount of movement, Kyra, that people should consider if they're trying to make a dent in their cancer risk through movement?
Yeah, the recommendation is to aim for 2.5 hours of moderate to intense aerobic activity in a week. And so that really just means something that gets your heart rate increased, your breathing rate increased, and although that is a target, everything that we do that is more than what we're currently doing is going to help reduce our risk of cancer.
How big of a problem are these the activities, the sedentary activities that you highlight in the campaign? The binge watching, the doom scrolling. How huge of a concern is that right now? I shouldn't say huge. Say I'm projecting what I think, but how big of a concern is that right now?
Well, we want to make sure that people are, again, understanding moderation, right? Not to say that that's not something you can't be doing at all, but it's that we want to make sure that we're also including movement in between episodes.
Yeah. Anything else to add about the campaign or what you're hoping people will think about as this continues to roll out?
Just a reminder that it's not just making sure that you are either being physically active, so like that you're exercising, but it's a combination of both, making sure you get exercise in and regular movement.
I should ask as a last question, who's in the campaign? Because we see someone sweating there and such. Are these Manitobans, or did you go for, did you cast for the folks in the billboard?
Yeah, we wanted to make sure that we found some images that really captured the essence of what we were trying to get across.
Got it. So they're not necessarily all local folks.
Correct.
Okay. I was wondering, you could take a picture of me binge watching up there. There's no face in that one, by the way. It's just a remote. Thank you very much, Kyra, for being in with us this morning and for explaining a little bit about these ads as people see them around town.
Thank you.